Today's topic of discussion is diabetes mellitus. It is one of the very important topics for university exam in many subjects, dentistry. It is a clinical syndrome or a metabolic disorder characterized by hyperglycemia, that is increase in the level of glucose in the body due to absolute or relative deficiency of insulin. Basically, there is increase in the glucose due to deficiency of insulin. Now we have two types of diabetes, type 1 and type 2. Type 1 is the result from absolute insulin deficiency, and type 2 is due to variable degree of insulin resistance. Type 1 is subdivided into type 1A and type 1B. The cause for type 1A is immune mediated and type 1B is idiopathic, that is, the cause is unknown. Now if we look at the pathogenesis for type 1A, so it is due to genetic susceptibility. There is already genetic involvement when it comes to diabetes type 1A. More than 90% of beta cells are destroyed by an autoimmune process in the body. That is why it is called as immune mediated. Now due to this genetic susceptibility, the person is already susceptible to diabetes, and there are some environmental factors which initiates this process, which causes insulitis, that is inflammatory response in pancreas, which ultimately leads to activation of autoimmunity. When this activation of autoimmunity occurs, there is development of immune response in the body. This immune response leads to the production of immune cells. These attack the beta cells. That is why we have written here more than 90% of beta cells are destroyed by autoimmune process. So this is happening within the body of the individual, and due to this attack on beta cells of pancreas, there is diabetes mellitus. Type 1B, as I've said, is idiopathic and it is strongly inherited. It is inherited from the parents. Now type 2, there is also genetic predisposition and acquired condition, that is lifestyle, obesity, aging, different kind of eating habits. So this ultimately leads to insulin resistance, which leads to hyperinsulinemia. As we've discussed earlier, diabetes mellitus is increase in the level of insulin. So there is hyperinsulinemia due to resistance of insulin in the body. Due to this hyperinsulinemia, there is compensated insulin resistance and normal glucose tolerance. Due to this, there is impaired glucose tolerance in the body, which leads to the failure of beta cells. Genetics play a role here as well. Genetics may cause insulin resistance, or it may directly cause the failure of beta cells. Acquired conditions, we've already discussed about obesity, lifestyle and aging. Now this failure of beta cell is type 2 diabetes mellitus. Type 1 diabetes mellitus is subdivided into type 1A and type 1B, immune mediated, idiopathic, where the cause is unknown, but usually it is genetically inherited. And type 1A is autoimmune response on which leads to attack on beta cells. Now the clinical features we'll be discussing in a differentiating manner. Type 1, type 2. So type 1 usually begins before the age of 40 years. Type 2 begins after 40 years. In type 1, the body habitus is normal to wasted, and type 2 is usually obese patient, as we've discussed. Type 2 में genetics and acquired conditions play major role, or acquired conditions maybe we had obesity, lifestyle and aging. So type 2 में patient is usually obese. Now type 1 में onset of symptoms may be abrupt with polyuria, polydipsia, polyphagia and weight loss developing over days or weeks. While Type 2 में the symptoms begin over a month to year, and the acute complication of type 1 is ketoacidosis. This is one of the very important things to note. Ketoacidosis is the complication of type 1 diabetes mellitus. While patient usually don't develop ketoacidosis in type 2 diabetes mellitus, there is decrease in the level of plasma insulin in type 1 diabetes, while plasma insulin may be normal to high in case of type 2 diabetes mellitus. When it comes to treatment, we usually give patient sulfonylureas, metformin in type 2 diabetes mellitus, and it is responsive to the drugs that we give. But in type 1, we usually have to provide patient with insulin therapy. Then only the patient shows response. Now for the diagnosis, we go for HbA1c testing. These are the normal values, and we go for impaired fasting glucose, impaired glucose tolerance, fasting plasma glucose, which is 126 milligram per dl, random plasma glucose, which is more than or equal to 200 milligram per dl, HbA1c, fasting plasma glucose, and random plasma glucose. These three factors you have to remember very nicely. After that, we have Benedict's test, which is done from the urine of the patient, and Rothera is also done for the urine for ketone bodies. Now for treatment, we have the first step is to estimate the daily caloric requirement for the patient. Step 2 is allocation of calories in proper proportion, and the third step is allocation of the calories. Now these are your non-medicational treatment modalities. Here you are not providing the patient with any kind of medicines or insulin therapy. You are just trying to maintain the glucose level of the patient by normal physiologic factors which are in your hand. When it comes to drugs which are given in type 2, whereas in type 1 we usually provide the patient with insulin therapy. The drugs given are sulfonylureas, glipizide, gluclazide, bigunite, metformin, which is very commonly given, alpha glucosidase inhibitors, acarbose, voglibose, thiazolidinediones, rosaglitazone, and now insulin, which is given in type 1. So there is ultra short acting, short acting, intermediate acting, and long acting. In ultra short acting में we have insulin as part, short acting में there is regular insulin, intermediate में lengthy insulin, long में ultra lengthy insulin. Now for the complications, we have diabetic ketoacidosis, retinopathy, neuropathy, nephropathy, coronary artery disease, cerebrovascular disease, and diabetic foot. These are all the complications which are related to your diabetes mellitus, and diabetes makes the patient more prone and susceptible to further infections. So you need to remember all these complications very nicely for your medicine exam. Thank you.